Happy New Year. We're gonna start with mention of our sponsors. Oh, and thank you everybody for coming. Our sponsor is Accent Style Boutique for the use of the space, Automated System Consulting for audio visual support, and Deborah Etit for Haitian Creole interpretation. Origin's mission and our core values after welcoming, Origin's mission and our core values are mission aims to increase the level of education and participation of BIPOC communities in positive behaviors to fight the different layers of disparities affecting these communities. Our speaker tonight is Ms. Allyson White. Allyson is a Florida-based certified herbalist and health and wellness professional who founded Naked and Natural, a plant-based skincare line that centers self-care, health, and love with vegan-friendly products and community-based workshops. Naked and Natural uses organic, natural ingredients packaged in eco-friendly materials to minimize harm to the environment and maximize the alignment of mind, body, and spirit. Allyson has earned her bachelor's degree in business management and health science, as well as master's degree in Oriental medicine. She is the member of the American Herbalist Guide and holds a clinical herbalist certification from Tradition School of Herbal Studies. Allyson leveraged her caring, generous spirit and her dedication to lifelong learning to expand her brand and contribute to her community through workshops and interactive presentations. She has shared her expertise and products at the Essence Festival and Herb Day, an annual showcase of holistic health professionals and services. And now, without further ado, Ms. Allyson White.
Oh, thank you. Thank you. Okay, I'm on. Okay, well, thank you guys for sharing and spending your Friday with me. Those of you that are online and those of you that are physically here. So today we are going to talk about health and how one size does not fit all. Our main topic and focus is going to be about high blood pressure, anemia, and anxiety. But before I get started, disclaimer time. So this is not a substitute for medical advice. See a licensed or trusted medical provider for all your medical needs. This, what I'm doing, is a primer. This is a place to start. This means do your own research, learn what's best for your body. And if that is too difficult or too time consuming for you to take part in, then see a trusted or medical advisor. Okay, let's get started. So let's start with high blood pressure first. What is high blood pressure and how can we help reduce it? So high blood pressure is basically the measurement of the force of the blood as it pumps through your arteries. That's what the medical providers, that's how they describe it. Now, you have a top number, which is your systolic number, and you have a bottom number, which is your diastolic number. So what I mean by that is you have 120 over 80 or 140 over 90, like, so when you're taking your high blood pressure, that's what those numbers are. Your systolic and your diastolic. Now, the systolic is the measurement of force in the artery as your heart pumps the blood. And your diastolic, which is the bottom number, is the measurement of force in the artery when your heart is at rest. Now, 120 over 80 is what's considered your normal blood pressure, or where the medical industry want your blood pressure to be. If it is greater than 140 over 90, consistently, basically you're bordering on having hypertension. However, that is not all of it. Everyone is different and certain conditions must be taken into effect. And what I mean by that is, these are the questions that I would consider asking. is your blood pressure consistently high, or was it high at the time of the visit when you went to your doctor? Was your blood pressure taken before the visit, and was it taken after the visit? The reason why it's important to know if it was only taken before the visit is there's something known as white coat syndrome. What that means is you go to the doctor and your blood pressure is elevated because you're going to see your doctor. He's your doctor. He's supposed to know what's going on with you. On top of being stressed, having to go see your doctor, typically your blood pressure is going to be elevated. So usually when you go in, you get it taken. But personally, I would definitely recommend taking it again after you've seen the doctor, because now, having discussed all the issues that you have, now you're a little bit calm, your blood pressure isn't so high, it's not pulsing in your ears like sometimes it's want to do. So definitely you want to make certain that you're doing it before the visit and after your visit. The other thing too is make certain that your doctor have you monitoring your blood pressure at home. So if your blood pressure is high and they don't know what's going on, because typically you go in, it's high because of white coat syndrome. Having your doctor have you get your own blood pressure cuff. They have them at CVS, Walgreens, Walmart. Have your doctor get your own blood pressure cuff and keep monitoring yourself as you go home. The important thing too to pay attention to, slow down. I know, right? Like, Allyson, you told on yourself. Huh. Anyway, the important thing to also pay attention to is, did your doctor include a telehealth in your naturally going to see them? And what I mean by that is, if he does a telehealth because your blood pressure is high and it's consistently high when you go to see them, doing a telehealth where you are taking your own blood pressure and keeping track of your own health, this way they can see whether or not it's something that's consistent or if it's just consistent with you going to see your doctor. So that's something that is important if your doctor offers that for you. The other thing too is your history, your family history, your lifestyle, all of this in regards to your blood pressure. That is really important. If that is not taken into consideration, your doctor shouldn't therefore say, oh, well, the last 4 times you've come to see me, your blood pressure has been high. Let's put you on a medication. I'm not saying you shouldn't listen to your doctor, because I'm not. I am saying you should start taking your own health advice, your own health in your own hands, if that makes any sense. So taking your own blood pressure at home, seeing where things stand with you, that is something that is important. Another thing is, what is your diet like? What are you eating? What is your family's diet like? Do you have a history of weight issue? Do you have a history of not eating properly or taking care of yourself? Those are other things that those are factors that absolutely need to be taken into consideration, as well as what's your exercise routine, all of that. So when you take these factors into account, you then understand what's going on with you, because one size does not fit all. I can't say, oh, you know what? This is my blood pressure, it's 120/80. For me personally, my blood pressure at 120/80, that's me having high blood pressure. So knowing where your blood pressure is, knowing where you stand, where your baseline, where your normal is, this is why one size doesn't fit all. Because if I'm 140/80, to some people, that's high, that's going into hypertension, but it's not that bad. But for me, that would be absolutely serious, because my baseline is somewhere between 112 to 115/60. That's my baseline. So anything higher than that is a problem. And knowing that will go a long way into you taking serious consideration about your health. Now, The other thing is what we also need to remember. We do not see our doctors with frequency. If we see her doctors once or twice out of the year, that's saying a lot. And a lot of times we wait until there's some kind of issues going on before we see our doctors. So if that's the case, you have to know more about your body than your doctor does. He went to school and he spent 12 years getting educated in, health concerns, health issues, being a doctor, but you spent 20 to 30 to 40 to 50 years knowing yourself. Your doctor is not going to know more about you than he does. So taking those things into consideration is exceedingly important. You got to be your own best advocate. Those are things that I would absolutely say. The other thing is, I understand that this is difficult. I understand that it's something new, being your own advocate, paying attention to your blood pressure, paying attention to what you have to do and what you eat and how you exercise. But this is where self-care starts. A lot of people think self-care is, okay, I'm going to go to the movies. I'm going to get my hair done and my nails done. Those are great. Those are great self-care starts. But if you don't take your holistic health into consideration, it's going to be a problem. So start with your health. So those are things that I would absolutely address and start doing. Also, cutting back on your excesses is a really, really important step. A lot of us don't realize that we work excessively. A lot of us don't realize that we have too much caffeine, whether or not it's from coffee or alcohol or any number of things, because what's 3 or 4 cups of coffee? It keeps me awake. Or what's 6 sodas? I'm drinking liquid. Or so what if I drink 2 to 4 beers a night? Those can be considered excesses, and cutting down and keeping track of your excesses is important. I'm not saying don't have your caffeine. I'm not saying don't drink your alcohol. I'm just saying if you normally do 2 to 6, how about we cut back to 1 and 2? That way our bodies start acclimating to what it feels like to not having those excesses in our lives. So pretty much another thing that's important to know is that about 70 to 80% of hypertension issues is actually due to lifestyle. So knowing what's going on in your life and what you're doing, please start paying attention to those things. Are you sleeping enough? Are you exercising? Do you have insomnia because you just chugged 6 cups of coffee the whole day? Those things you have to, or not just coffee, but caffeine or energy drink or whatever the case is. Those things you absolutely have to pay attention, because what people need to understand is that high blood pressure, high blood pressure is literally just a symptom. It's your body literally telling you that there is a problem. It's just a small symptom of what could be a larger issue. So understanding what's going on with your body will allow you to figure out what to do, where to go, what processes to take. Now, what I want to talk about are some of the issues that high blood pressure could be creating. Water retention and kidney function. The kidneys have a pretty large influence on the heart. So if you have problems with your kidney, and that's undiagnosed problems, that could be causing high blood pressure. So when the tissue of the body is filled with fluids, otherwise known as edema, it puts pressure on the blood vessels, which therefore restricts the flow of blood. Undiagnosed kidney issues could be some of the problems that you're dealing with. So some of the things that you really need to start paying attention to is, do you have lower back pain? Are you, like when you sit or when you stand, whatever the case is, are you experiencing issues with that? Your hands and your feet, are you noticing that they're swelling and that it's really uncomfortable to walk on? Pay attention to that. Let's see, underneath your eyes, do you have puffiness underneath your eyes? So knowing that some of these things could be creating the issues, now you're armed with potential things to talk to your doctor about. So if you have consistent high blood pressure and you're checking yourself at home, now your doctor is like, okay, you do have some issues. Let's check your kidneys and see maybe if there's something going on, because nothing else is indicating anything else. So those things are what you need to and urinary issues. Do you have problems going to the bathroom? Is it difficult problems going to the bathroom? Is it a brown color when you go to the bathroom? Is it not enough urine when you go to the bathroom? So those are additional things to add into what you need to talk to your doctor and have him test. And sometimes they may try to push you off like, no, it's not a problem. This is where being your own advocate is absolutely important, because if they don't want to do the test, I believe there's something that you can say. It's like if you ask them for a test and they say, oh, I don't want to do it, you can say, please write it in my chart that I'm asking for these tests and you don't want to do it, because it's documentation that there's an issue. So now they'll say, okay, fine, I'll get it done. So you want to make certain that you're asking them to either document it or get you those tests so you know what's going on with your health. Dehydration. If you're drinking too much coffee or caffeine, you are going to absolutely be dehydrated, because coffee is a diuretic. It's going to make you pee a lot. It's going to make you poop a lot. So you're going to be losing fluids. So you're going to be dehydrated. So if a person becomes dehydrated, it reduces the volume of blood in their blood vessels, which causes them to contract, and the pressure then results in high blood pressure. So that's how you know high blood pressure. People who are mature, I don't want to say old people, but older people who are mature, they typically have issues with drinking water. If you have problems with drinking water, then eat some fruits. There's water in fruits. If you don't like water, then maybe start juicing, because then you'll have some fruits, which will give you water, which will help do the things that needs to be done, which is no longer being dehydrated, peeing properly. You need to pee. Yes, absolutely. So dehydration is definitely a cause for high blood pressure. Stress. Oh my God, stress. Your emotions will affect the overall function of your heart. Anyone ever scare you and your heart start palpitating? You ever mess with your own mind and scare yourself?
Yeah.
Mentally, emotionally, stressing yourself out. Stress will cause that, because basically, whether or not the stress is real or perceived, your sympathetic nervous system will become active, which makes your body tense up, puts you in a fight or flight response. Your body then releases adrenaline, which causes your heart to beat faster, which creates high blood pressure. So if you're constantly in a fight or flight mode, if you are constantly stressed out, whether or not it is your home environment, whether or not it is your job, your kids, your boyfriend, your husband, whatever, pay attention to why you're having high blood pressure, because stress it's absolutely serious. Caffeine, again, I'm going to bring up caffeine. It increases stress response. So you're stressed out, you have some caffeine. Oh my God, you're going to be so stressed out. Your adrenaline is going to be pumping. So you're thinking, okay, I'm stressed out. Let me have some caffeine. Let me have a cigarette, which is definitely not good for high blood pressure as well. These are things that we're putting on top of and exacerbating the issue. We don't want that. So we definitely want to make certain that we're taking care of that. A few other issues that can actually cause high blood pressure is excess weight. Basically, if you have too much weight, what it does is that the extra fat increases your vascular resistance, which basically will cause your heart to pump more. So it's like the extra weight is causing your heart to work extra, to pump more, to keep going, which causes high blood pressure. Hardening of the arteries because you have a blockage, because the blockage, the arterial plaque that creates an obstruction, which causes the heart to work harder. You definitely don't want that. Vasoconstriction, when there's a constriction in the blood flow, that will absolutely cause high blood pressure. And magnesium deficiency. A lot of us are deficient in magnesium, and most Americans, there are two things that they're deficient in, and I'll just talk about magnesium, but they're deficient in calcium and they're deficient in magnesium. And magnesium really helps your body and your muscles to relax. So you're not tightening, you're not tensing up, you're not in fight or flight. So without that magnesium, that's why people start doing the magnesium lotion, they're doing the magnesium pills. It will help to calm you down. So seeing if you're deficient in magnesium is something that you definitely want to look into. There are absolutely small things that you can do in regards to lowering your blood pressure, in regards to taking care of your health in that regards. You don't have to exercise. We all know exercise is important. And sometimes we all want to go hard in exercising. If you have Natasha as a trainer, yes, Natasha, I'm throwing you under the bus. Just give me one more. Anyway. So there are exercises that you can do where you're just really softly taking care of yourself, whether or not it's going for a walk for half an hour, doing Tai Chi, doing Qigong, yoga, Pilates. The reason, yes?
I have a question.
Sure.
And you're okay.
Hold that question, don't forget it. So yoga and Tai Chi are definitely important, and I mentioned these because you don't necessarily have to go to a studio or go to a gym. It's as simple as opening up your TV and logging on to YouTube, or opening up your phone, logging on to, however you can see YouTube. They have Pilates, they have yoga, they have Tai Chi, they have Qigong, they have all these exercises that you can really do to help your blood pressure, to help your circulatory system work the way it needs to work. And it will actually help you feel good. It will actually help you to calm down. So those are a good place to start. Now, foods that you can start to incorporate. I'm just going to say simple foods. Some people have access to some of these, some people do not. Apples, asparagus, avocados, bananas. I'm going to say cheese, but kind of sort of not for Black people or Asian people, but we love our cheese. But if you are going to do cheese, do the harder cheese. Don't do the soft cheese. Don't do the brie or the stinky one. What do you call that?
Goat cheese?
No, goat cheese is actually good. Goat cheese is something that you can have and not worry. Goat cheese and feta cheese, along with the hard cheeses, those cheeses you can do in moderation. Blue cheese, no blue cheese. So if you're going to do cheese, definitely do the hard cheeses, definitely do the feta cheese, definitely do the goat cheese, and you can do sheep cheese as well. So those to look out for. Eggs, honey, kidney beans, mulberry, pineapple, pomegranates. Okay, so there's something called doctrine of signature. And doctrine of signature is looking at a fruit or looking at like say beets or red, watermelon or red. Like a lot of the times, the doctrine of signature where the items are red, it actually is good for your heart and your blood and your circulatory system. So most red things, that's why they tell you beets are really good for if you have anemia. So most red things, really good for your circulatory system, really good for your heart, really good for your blood. So definitely keep doctrine of signature in mind. Spinach is good. Leafy green vegetables. Don't overdo it on the leafy green vegetables because it's not the only thing that is good or healthy for you, but do add some of that to your diet because those can be like a good source of iron, which helps to build blood. And I'll talk more about that a little bit later. Yams. Any kind of yams. If you're Caribbean and you like your sweet potato or your yuca or your yellow yam or whatever the case is, yams are a good source of vegetables to start adding into your diet. Okay. Now, those are foods that you can basically add to your food bank daily. And also pay attention to certain fruits, not the bad stuff. And I mean the pizzas and all of that. Pay attention to the fruits and vegetables that you're craving, because a lot of the times that's your body telling you that there's something in those fruits and vegetables that you really need in order to thrive and be healthy. So that's something that's super, super important. Okay, now that we've talked about high blood pressure, we're going to talk about anemia. Now, anemia is the problem of not having enough healthy red blood cells or hemoglobin to carry the oxygen to your body's tissue. So some of the signs and symptoms that you'll find, this is not all of them, but some of them, you'll experience fatigue, pale skin if you're light, and if you're dark, your skin will start to look gray, like it'll start to have that like grayish looking tint. Pay attention to that. Let's see, your nails will be brittle. Your sometimes your eyes will definitely be dried out because you don't have enough blood to circulate to give you healthy nails, give your eyes, make your eyes healthy, fluids in, and you're always cold. So these are just some of the things that you want to look out for when we're dealing with anemia. So if you go to your doctor, I have some tests that you can ask your doctor to run for you to see if you are anemic. In addition to the signs and symptoms, these are some of the things that will come up. So it's not just one thing that you're looking at in regards to if you have anemia, it's a holistic picture you're looking at if you have anemia. So if you're fatigued or dry eyes or brittle nails, doesn't necessarily mean you have anemia, but it could mean that there's a deficiency there that you need to start looking at. Okay, so your serum iron, basically this is a test and it's testing the amount of iron that's in your blood. So if you go and get tested from Quest Diagnostic or what's the other place where you can just pay out of pocket and get tested? There's Quest and then there's the
LabCorp.
LabCorp, thank you. So question LabCorp, you can actually pay out of pocket if you don't have insurance and they will actually get you tested. And I want to say the range is somewhere between $75 to $130. And you need to tell them, like when you go, you need to tell them that these are the tests that you want, because don't just think that just because you go, they're going to, oh, I want testing. No. have a list of things that you need tested. So serum iron is one of them. TIBC, which is the total iron binding capacity. This is the test. Basically, it tests your body's ability to transfer blood all over the rest of your body. Now, if your TIBC is high, that means that you have low iron. And the range for your TIBC should be anywhere from 250 to 450. Any higher than that, and there's potentially a deficiency that you need to look into. Your ferritin levels is another test. You can look at your ferritin levels. Basically, that indicates the amount of iron that's stored in the blood cells. So get your ferritin levels checked. The ferritin level is a wide range. It's anywhere from 12 to 150 in women and 15 to 300 in men. So if your ferritin levels are low, it doesn't necessarily mean that you have anemia, but it does mean that you have an iron deficiency, and that's an indication that if it's not taken care of, and if you don't get yourself checked out or whatever, it could turn into anemia along with the other things that you're looking at. Your hemoglobin levels are basically is the amount of protein in your red blood cells, and it basically is delivering the oxygen to your tissues. So in women, your hemoglobin levels should be 11 to 14, and in men, I believe it should be 13 to 16, but that's a little bit, you'd have to like double check that just to make certain, but I do think that is correct. Your hematocrit, the percentage of red cells in your blood, men's hematocrit should be 41 to 50%, and women's should be 35 to 50%. I know these numbers that I'm throwing out are a little bit like snooze-worthy, but if you go and you get them checked out, then at least you'll understand what's going on, and your doctor can help you read this. Or if you're not comfortable going to your doctor, then see a practitioner that you trust, that you know will be able to read these and will be comfortable explaining to you what it is that you need to do. Now, the interesting thing about all of this is, and as like I said before, is that you shouldn't be looking at just one thing, because it's not just one thing that's going to indicate what's going on with you. It's all of this as a whole. It's how you're feeling. It's what your test says, because your test could say your hemoglobin level as a woman is at a 10, but everything else is fine. So paying attention to what's going on holistically is absolutely going to be something that's important. Now, the other thing that you have to take into consideration is if you have a supplement, if you have to supplement your body with iron, then taking it with vitamin C will allow your body to absorb it better. Hydrochloric acid or digestive bitters in your stomach, those are absolutely important in order for the absorption to work in regards to iron. Pernicious anemia is something that people have. And this is pernicious anemia is the body cannot properly absorb B12 due to the weakening lining, basically a protein in the protein intrinsic factor cannot bind to B12 so that it can't be absorbed. So for the people who have pernicious anemia, that's why the intrinsic factor in their stomach is not allowing the B12 to be absorbed properly. So that's an issue that people have. Now, the other thing is megaloblastic anemia, not enough B12 and not enough folate. So that will give you megaloblastic anemia. So these are things that you will see on the test. These are things that you'll understand, or your practitioner will understand, or your doctor will understand in order to know what to prescribe you, what to give you. And if you don't feel comfortable, again, going to a Western doctor, then there are practitioners, there's acupuncturists out there that know how to read these tests. There's clinical herbalist that knows how to read these tests, but ask them first. Seek out somebody that you're comfortable with. Seek out someone that is going to, that you feel comfortable with, that is knowledgeable, and it feels like they're knowledgeable, not just somebody because they're acupuncturist, or not just somebody because they're a clinician. They might not know what you need them to know. So find out, ask questions. Again, this is your health. Now, some of the foods that I talk about now are basically going to be a repeat of the other foods, because a lot of this is blood, it's heart. So you want blood, like the high blood pressure, you want foods rich in blood and circulation and all of that. So rich leafy greens, if you're a vegetarian, beets, B12, B complex, those are some things that you can add to your diet. But if you're not a vegetarian, you can still do all of those. Included in that is beef liver. Included in that is beef and eggs. Aduki beans or adzuki beans. It's all the same thing. It's just the way they spell it. Apricots, dates, figs, grapes, kale, spinach, kidney beans, oxtail, things like that, mussels, sardines, seaweeds. Those are things that you want to incorporate and include in your diet, because that will help to build blood, that will help do the things that it needs to do. So then you get your circulation. And interestingly enough, you'll start feeling it. Once you eat something that is really good for you, I don't know if anyone else experienced this, but it's almost like your body does a sigh and you feel good after you've eaten it. And it also sometimes put you in a good mood if you've eaten good food and healthy foods for you. And the opposite is true. If you eat something that's not good for you, you'll start feeling a little bit low and a little bit depressed and wonder why your mood plummeted after you ate. Pay attention to what you're eating. Herbs that are good for that, especially if you're a vegetarian or if you're somebody that likes herbs or want to go with the herbal way: nettles, alfalfa, yellow dock, and dung quai. And this you can get at any apothecary. These are really good herbs to add into, like, making teas with it. Shonda mentioned her dog had skin issues, allergies. Mixing nettles, grinding up nettles and mixing it in your dog food will absolutely help the allergic reaction that your dog has, and help clear up your dog's skin issue. So nettles is good for humans and dogs. The last thing that I really want to talk about tonight is anxiety. The last thing I want to talk about is anxiety. Now, anxiety is a complex combination of dread, fear, apprehension, nervousness, and worry. We've all experienced anxiety in some way or another. So some of the things that we'll definitely feel while our anxiety is up is palpitations, cold sweats, trembling. Either your voice is trembling or your hands are trembling. You may even feel lightheaded if you're in an anxious state. And the funny thing about anxious state is that sometimes when we have to do a presentation or when we are being put on the spot, somebody says, "Hey, Ram, tell me about XYZ." It's like your mind goes blank. You're like, "What? I'm not prepared." So some of these things could happen. Your mouth could go dry, all of that. Job interviews, you name it, anxiety can come up. And especially if you're facing old fears or even new challenges, you're going to face that. It's normal. And the thing about having a mild case of anxiety, the interesting thing about a mild case of anxiety is that it sometimes can push us to do the things to make us greater. I.e. asking a guy or a girl out, giving your boss giving your boss a pitch that is going to make the company money, something that is going to also help you get promoted, facing some of your fears. Some of these things are normal. Your pulse rate gets going and you're alive, but you're anxious. That's normal. What is not normal is when basically anxiety interferes with your day-to-day life. When your anxiety is chronic, when out of nowhere you're sweating, your body is trembling. It's like you have no idea what's going on. You have your palpitations. It's just a constant and chronic thing, and it interferes with your day-to-day life. It interferes with your driving, you taking care of your family. It interferes with you taking care of yourself. So anxiety can really be chronic, and some of the serious health problems then that can come up with anxiety are things like heart disease, high blood pressure, phobias that can turn into obsessive compulsive disorders. Like, we don't think about those things in regards to anxiety, but those are things that can happen. And that's just to name a few. And interestingly enough, addictions like drug and alcohol abuse have been linked to people having anxiety, and this is the way that they deal with it. So anxiety is really, really serious. And I remember a few years ago, I had an anxiety attack. And funny enough, I had no idea what was going on because back in 2000, was it 2007? No one was talking about anxiety. No one knew that, you're breathing, can't breathe, crying. This was my symptom. Couldn't breathe, crying. And when I say it came out of nowhere, I mean, 1 minute I was talking to someone, the next minute I was literally crying in a corner because I had no idea what was going on. These are some of the things that can happen. Now, if it continuously happens every day and you don't know what the trigger is, that could basically put a stop in your day-to-day life. That could make it so that you can't drive because you don't know when a trigger is going to happen. And all the health concerns that I mentioned before is going to be an issue. So when you're suffering from an anxiety-related disorder, it's basically your hormones and your neurotransmitters that's out of balance. And you need to basically find the triggers and basically see someone to get all of those things back into balance. Fortunately, if you don't want to go to a Western doctor, again, there's practitioners can help you with things like an adaptogen or formulas that can help with spasmin, like spasmatic formulas, things like that can help you. Like an adaptogen basically helps to reduce the output of stress-related hormones. So it's not going to take your stress away, but it's going to help your body know how to adapt to stress better, which will calm you down. And these are things that are really helpful with adaptogen. It will help boost your immunity. It can help with insomnia, fatigue, cognitive functions, balancing your blood sugar, reducing high blood pressure, reducing cholesterol. So the right adaptogen for you is definitely something that you for sure want to look into. Just to name a few of the things that that can help reduce anxiety, but it has such a wide range of uses. It's just a matter of finding what is going to work for you. Now, the best advice we're given about anxiety and stress is from your doctors or your friends or your well-meaning family is stop stressing, reduce the stress in your life. Now, the problem with that is if I knew how to do that, I wouldn't be stressing. So it's learning how to It's learning how to put things into place. Because honestly, telling somebody to stop stressing is like telling somebody to calm down when they're upset. And I'm sorry about, I don't know about anybody else, but never in the history of somebody telling me to calm down have I ever calmed down by them just saying those words. So one of the advice I would definitely give to help with the fight or flight response going on is to have a good adaptogenic formula or a good Bach remedy formula that you can take, keep it on hand. You can take that because that will help to calm you down almost immediately and help reduce the stress that's going on, the anxiety that's going on. Another thing that I would absolutely recommend is to have 5 things put into place that you know if you do these things, it's going to help reduce your stress. So now that you've taken your adaptogen, now that you've taken your Bach, your rescue remedy, or your flower essence that's going to help with that, think about 3 things that you can do. Is it walking? Is it exercise? Is it yoga? Cooking or dancing? Do these things help take you out of that fight or flight response? Do these things help you reduce your stress? So having these things in your pocket will help. So when this does happen, you do get your anxiety and your brain feels like it's shut off. At least these are things that you start to make a habit. And when you start to make it a habit, you don't have to overly think because you've made a, what do you call it, a pathway in your brain to know what you need to do in order to get over these things. So just to name a few, these are things that I would absolutely put into place that is going to help you get to a place or get to a state of mind that is going to help reduce and calm things down. So you can either call the people who you need to call for help or get into a place where you're not so manic or not so in a fight or flight response. Some of the foods that can help you, again, leafy greens, eggs, spinach, kale, Swiss chard, blueberries, interestingly enough, oysters. Oysters basically help reduce your stress levels, nuts and seeds. So those are the foods that I would definitely recommend start putting in your diet. And eggs kept on coming up because eggs actually, it's really good for your blood. It's really good to help build blood, interestingly enough. So if you're starting to crave eggs and starting to crave leafy greens or things like that, that's something that you definitely need. And personal case in point. So back in 2017, I was definitely not listening to my body and the things that it needed. I did not know it at the time, but at that time, my body was starting to indicate that I had fibroids, and the fibroids they were small at the time, but they were starting to grow enough so when I touched my belly, I could feel it. I was craving eggs. I was craving spinach. I was craving grapes. I was craving everything that could build blood because, of course, fibroids basically divert the blood from where it needs to go, which is circulate my body and my brain and all that, to where the fibroids were. So this is why I say, if you start to pay attention to your body, the things that you crave, the things that you need, your body will tell you what you need. And you will start to understand that, okay, I need to go see a doctor because I think something is wrong. Paying attention to your body is honestly one of the biggest things that every single time I do a presentation, I will tell you to start paying attention to your body, start paying attention to what it needs, what it's craving, how well you're feeling or how well you're not feeling, because these things are a good indication to tell you where you are and where you need to be. So, ultimately, one size does not fit all. I'm not the same as Angie. I'm not the same as Shonda or Natasha or Ram. And so ultimately, if you want to make certain that you're doing what you can for your body, you're seeing the doctors, when you go and see your doctor, when you go and see your practitioner, make certain that they're not painting you with the same brush that they paint everyone. Make certain that they're not saying, well, I gave this to this person, so it should work for you. And you take it and you have no idea why it's not working for you, because this person didn't have the extra thing that you have. So understanding what's going on, paying attention to what the doctor is telling you, asking questions. Oh my God, I can't stress that enough. Ask questions. If you do not ask questions, you're not going to understand what is going on with your body.